Welcome to On the Edge of Health and Design, the podcast where healthcare meets design, with your hosts, Nita and Sylvia.
Hi, everyone. Today we welcome Dr. Ju Eun Lee, a geriatric psychiatrist from Toronto, Canada, where we are based. June is a member of the Canadian Coalition Against Ageism, as well as the International Longevity Centre based here in Canada. Welcome, June.
Thanks for being here, June. To start our interview off, what does healthcare design or design for health mean to you?
I think when you asked me to come on this podcast, I didn't actually know exactly what you meant by design, but I think when I was thinking about it, I was thinking about it more through the lens of the healthcare user and really a system that's radically inclusive. We talk about a lot of barriers, a lot in the context of socioeconomic factors. But we don't really, go into details of things like, is this place accessible for people with certain physical, psychological limitations like hearing impairment, trauma, anxiety? Do we accommodate everyone? Do we accommodate people with different views about health, like a non-judgmental kind of system? I also think about, when thinking about healthcare design, is it a design that can also teach and enforce healthcare providers to provide inclusive care?
When we talk design, we mean design in any sort of sense. So it could be like design of a structure, but it could also be design of a program or the way that the healthcare system is structured, like the funding models. Like it could be any form of design, from design thinking all the way to physical design of spaces. So I think that's a great answer. Like inclusivity is something that sometimes people think that they're doing, but they're not actually doing. Because I remember when Sylvia and I were in grad school and we were brought in to help reduce falls risk in older adults at like a rehab and long-term care, and they seemed to like practice accessibility, like in terms of like the standards and things like that, but was it really truly accessible to all of the residents? Well, no, because there's evidence that there were increased risk of falls related to multiple factors. So it wasn't accessible and inclusive to everyone, right? On that same vein, you talked about inclusivity and maybe you don't see it everywhere. And do you think that that's a big challenge, or what do you think is the biggest challenge in healthcare from your perspective?
I mean, there are a lot of challenges. And we just talked about how complex, design and the system looks like. As someone primarily working with older people, I think the biggest challenge that I see every day, all the time, and even outside of healthcare is ageism. We are an aging society. There's no question about that. The boomers are aging. And we actually have a lot more people over 65 than people under 15. And with the boomers aging, we're actually expecting an acceleration of the aging population growth. Are we prepared for that? I'm not sure. I think there are only a very few number of clinicians who are actually really interested in working with older people, which is fine. But the rest of the clinicians, and I'm not talking about just medicine, I'm talking about pharmacy, dietitians, PSW, so personal support workers, all these groups of healthcare workers. It doesn't matter whether you work in general adult, older adult. At the end of the day, you're going to see a lot more older adults wherever you are, maybe except in child and adolescent fields. So it's a big problem in that we don't really know how we are going to be able to accommodate this population when we clinicians are not trained enough. And I also wanted to mention that I struggle with a lack of preventative care for older people. And I think it stems from ageism in that we are not focusing on really positive health and quality of life with older people. Instead, old age tends to be associated with decline. It's associated with being rigid, being weak, and it's closer to death. So we have this fear of aging and fear of death. So because of that, we tend to focus more on managing perhaps illness, managing problem solving around stuff like already existing problems. Whereas preventative care, when we're thinking about preventative care, we should be thinking about promoting healthy aging, having people stay at home as long as possible, not promoting dependence, but more independence. And in order to do that, I think we need to invest more into programs, community programs, not just really like hospital care, but more so in the community.
June, you did mention some key opportunities. Do you want to expand on them a little bit, or on the key opportunities for the application of design in healthcare? And it's because, at the end of the day, I'd like to think everybody's pretty creative. Every day we have multiple thoughts in our minds, and we do come up with things in the line of work. We have thoughts of like how we could improve our own work and how we can help people a little bit more. I see that as creativity. So is there anything that maybe you thought of that could help with this ageism?
I do a lot of advocacy work, and that's really trying to raise awareness about ageism because we don't actually know a whole lot about ageism and its impact. I certainly did not get taught about ageism. I don't know about you, Nita, in pharmacy. Was that something that you were taught?
No, not at all. Yeah,
Yeah.
I heard about it more recently. I'm a lot older than you guys, so I have personally experienced a little bit of ageism. Like when I was searching for work, I found out that jobs that I was applying for, it was harder to get an interview unless I put less years experience, unless I kind of took away 10 years of my experience, then I would have a chance. Yeah, so it is out there in subtle and not so subtle ways.
Yeah, and I think it's really difficult to recognize it, realize it until you're a little bit older, right? And you start to experience it yourself. The reason why I brought up whether you've had experience kind of learning about this is because that's it. We just don't know. And if nobody's talking about it, how do we implement change? So I think part of the work that I'm trying to do with a group of people, the Canadian Coalition Against Ageism and their International Longevity Center, is really that awareness, going out there, going to as many conferences for academia, different webinars, any form of community outreach that we could do. We try to do. We're also trying to make sure that we implement it in education curriculums, things like that. Do I have an idea of how I could design an ageism-free kind of healthcare? Not really. And I think that's because more and more I learned about how important it is to involve the people who are using care to design the care. I can say, in my office, make sure that I have chairs with arms so that, when they're sitting, it's comfortable and they're not going to fall. But a patient of mine might say, they want a larger chair without the handle because it's more comfortable. I don't know what people want because I am not them. I am not in their position right now. So I think it's important to gather what it is that people need from their experiences, as opposed to me kind of thinking what might be good. And I think that's a problem that we currently have, is that we just kind of assume what might be best for people. And that is ageism, is kind of in a way being paternalistic rather than really listening to them.
I wanted to just skip over to another question because I want you to explain what ageism is and what kind of health, social, and economic impacts is it associated with.
I'm going to give a WHO, World Health Organization definition of it because it's my favorite one. Ageism is stereotypes, how we think, discrimination, how we act, prejudice, how we feel, directed towards people on the basis of their age, just purely their age. And there are a few different types of ageism. We have the self-directed ageism, which is ageism turned against oneself. So, for example, I'm not going to learn how to use my iPhone because I'm too old. I'm hopeless. This is something that, people say actually quite frequently. When I try to do virtual appointments with some of my patients, I say it's just a click of a button. But to them, it's impossible because they're not used to it and they're not going to learn because they say that they're too old. It's not because they have any cognitive issues. It's just purely ageism. And then there's the interpersonal ageism that occurs between interactions. So this is me being ageist in the past, hopefully in the past and not again. But I used to speak more simply and louder with older people. And that's me just assuming that older people, they may need to have things more simplified, or they have hearing impairment, and just kind of assuming that me doing that will help them. That's actually called elder speak. There's a lot of literature and research on that. And when you look at some of the studies interviewing older people about their experiences in healthcare, that's one of the major problems that they point out, is that healthcare providers are paternalistic. They do this elder speak thing. It's like baby talk when they're totally cognitively intact or not hearing impaired. Finally, we have institutional ageism, and that refers to different laws, rules, policies, practices that disadvantage older people. Nita, you had talked earlier about age being disadvantaging you in terms of finding a job. This is very common, right? We see arbitrary age cutoffs that aren't really written anywhere, but it is something that exists. Also, that arbitrary retirement age, 65. I mean, it's not really arbitrary because the whole society thinks 65 is like, that's it, you're geriatrics when you turn 65. It doesn't matter your skills, your cognitive level, your function. 65 is the age you retire. And yes, it has to do with the economic stuff, the pensions and all of that. But is that institutional ageism because it limits people? Yes. But do we think of it that way? I don't think so yet, but I really think that it is. I think it's very important for all of us to know that the World Health Organization says, based on a global report on ageism that they published in 2021, that 1 in 2 people are ageists. So between the 3 of us here, 1 to 2 of us are. But I think that's actually an underestimate. Probably more like 2 to 3 of us are ageists. And I laugh about it because it's a crazy statistic, right? To think that, you're an ageist. We don't like to be an ist of really anything, but based on the fact that we don't know much about it, and it is one of the only isms that the society really allows. So a lot more of us are ageist than we think. In terms of some physical impact, it's really linked with reduced lifespan, reduced physical functioning, being delayed in treatment or denied treatment, because sometimes even clinicians, they might say, oh, it's just normal part of aging, right? Being forgetful a little bit or having a little bit of high blood pressure, that's normal because you're aging. So you may miss that chance of getting treatment. It's associated with poor mental health. People are at increased risk of depression when there's a lot of ageism that they've experienced. For example, somebody with low self-esteem, feelings of burden, all of those are some worries and thoughts that you might develop and lead to depressive symptoms. It also increases social isolation and loneliness. So if people are feeling unwanted because of their age, undesired, unproductive, they are more likely to withdraw from social interactions. And there's that self-fulfilling prophecy. Old age is a time for lower social interaction, lower participation. Therefore, they just don't go out as much. And it's also associated with increased risk of dementia. And I'm bringing this up because that's how severe ageism can be for our health. It's again that self-fulfilling prophecy that I'm getting older, I'm not going to learn anything new. So you're not practicing any positive brain health. I'm getting older, so I'm going to depend on my children to do stuff. So you're losing your independence. And I always tell my patients, if you don't use it, you lose it. So lots of impact on health. And there's so much more that, I'm not going to talk all about it here. But I do think that the listeners would benefit from reading the World Health Organization's global report on ageism. It's actually a fun read.
Post that in our show notes for anybody that's interested in reading the article. Thank you.
So just stepping back a little bit, I'd like to get into your professional journey and what drew you to this area working with older adults.
When I kind of looked back, when it was time to apply for subspecialty programs in geriatric psychiatry or child and adolescent, or there's also forensic and other departments, I realized that my most memorable learning experiences, my favorite patients, my favorite cases were all geriatrics, working with older people. I really like neuropsychiatry, I like dementias, and I like taking time to really figure things out. And I think within geriatric psychiatry, we have that luxury to take lots of time. You know, you need that extra patience because if somebody does have dementia, it's not just working with the patient, but with the family. So I think that really drew me to working with older people. But I also think maybe because I have very old parents, my parents are older than my friends' parents, and I'm very, very close with my grandmother. So maybe perhaps that, made me feel more comfortable working with older people. I enjoy it quite a bit. I love joking with older people. I talk about ageist jokes with them, not because I'm being ageist and saying ageist things, but I like to challenge them to see how they feel when they hear things like ageist jokes. Yeah, I just have a lot of fun.
And they're so full of wisdom too. They
That's
really
a
are.
positive stereotype. That's a positive
Yeah.
stereotype. Yeah. And I think as healthcare providers, Nita and we are more likely to see ill older people.
Yeah.
Older people who are more likely to be weaker, to be cognitively impaired. So that just gets ingrained and then it just cycles. And then, so whenever we see any older person, we tend to assume perhaps that they might have the weakness or whatever. So I think it's more reason why healthcare providers have to really work to challenge those biases and not apply them across, everyone.
Yeah, that's a really good point. I've definitely found myself ageist at times. So your stat is probably correct. Two of us in this virtual room here are probably ageist at one time or another. Yeah. I understand that you attended something called the Ageism Forum that was held about a year ago now, right? June 2024. So what was that like? Like, how did that work and what was the design of it? Like, and what came out of that?
Yeah, thanks for bringing that up. It was a forum. It was funded by CIHR Planning and Dissemination Grant, the Canadian Institute of Health Research. So a bunch of us who were working in the field of ageism, and I was not as senior as some of them. I was a student. A bunch of us really got together to build this forum because we never really had anything like this before where people gathered together to talk about ageism, its impact, and what we need to do to make changes, particularly in healthcare. We have a short period of time where we had to kind of plan this forum and invite people, and we invited a very diverse group of people from the community, older persons, people in academia, healthcare workers, community organization leaders and advocates. And I think we actually did a really good job in finding this diverse group of people to come to this forum and discuss what we need to do. We were in little groups, basically, and we talked about, what are some critical issues related to ageism? What are some interventions that are happening currently? What do we need to do? And we also talked about things like equity, diversity, and inclusion, because we talk about that a lot. There's EDI everywhere, every organization. There's mandates now. We talked about the fact that age is never really brought up in those EDI principles and mandates, and how can we implement it? How can we make ageism something that organizations take accountability and responsibility in eliminating? So it was a forum that really raised a lot of questions. Also a forum that let us know that there are a lot of people interested in this, but everyone's kind of doing their own thing separately in different parts of Canada. So it was a really nice opportunity to say, okay, there's a lot of us here interested in this. A lot of us want to work on this. Let's start doing things together instead of all siloed. Because we're doing excellent stuff in our own little communities, but because it's not in it's not something that that is part of a curriculum or part of an accreditation standard, it's not really being done regularly or across all sites. Only a few select community groups or hospitals have opportunities to talk about ageism. Like, for example, our hospital, we had the opportunity because I did my grand rounds on ageism. So, a few of us were able to hear about it. But, there are other places, other organizations where you're not going to have an ageism expert. So how are they going to learn? So we got together to say, okay, we have some important work being done. How can we disseminate this to everybody across Canada?
How can you disseminate it across Canada? What is the strategy that came out in the end?
So fortunately, it was a small group of people, but within the small group of people, we were able to make working groups. So we have working groups for education, for awareness, for research, and for intergenerational interventions. And so what we're doing is we're gathering experts in the field, coming together, trying to find ways to bring it to all organizations as opposed to small community local groups. We're trying to involve public health. We're trying to do more policy work as well. I was especially interested in education, and my goal is to include education about ageism within the curriculum. And in order to do that, we have to really target accreditation standards. So part of what we're trying to do is find these areas where we can get healthcare forces to implement it. And I'm talking about education, but it could be through like workplace initiatives. In the hospitals, we do those e-modules, right? About fire safety, about diversity, culture, and all of that. Like, can we get ageism into it? So those are some of the things that we're trying to do a little bit bigger than what we're all doing kind of separately.
Yeah, that sounds really good. Corporate type orientation things, I think it might be useful. They never talk about that stuff. I've been to several of these corporate orientations because I tend to jump around between different jobs over the past couple decades. And yeah, it's never come up. How about you, Sylvia? Have you had anything like that? No.
Equity, diversity, and inclusion, but it never includes ageism. I do agree. I think that should be brought up because at my workplace, we're all about equity, diversity, and inclusion, like very much so, but nothing about ageism. And honestly, I might bring it up at work.
That's great. And I actually recently gave a grand rounds at another hospital. I cheated on my hospital and went to another hospital and did a similar talk on ageism, but I actually focused more on ageism within the workplace. So your interaction between your coworkers. And I actually talked quite a bit about the boomers versus the Gen Zs versus the millennials. And I wasn't trying to stereotype and put people into little categories. But what I've read in the literature and what I've encountered in my own workplace is that when a younger clinician or a student does something, we tend to say, oh, that's a Gen Z thing. Or when an older person does a certain something, then we might say, oh, that's really old school, and might blame it on their generation as opposed to kind of working on the problem with a person. We have this tendency to do that. And as part of the strategy to overcome ageism, the WHO actually recommends more intergenerational contact and interactions. Are we doing enough to understand each other? I'm not sure. I think we tend to blame based on age as opposed to trying to understand why the Gen Z group, the younger generation, are the way they are, why they are more fast-paced. And that's because they grew up in a very fast-paced world. They're different than the millennials, where the millennials had both a little bit of digital and a little bit of looking at actual paper, reading the
Yeah, like
paper
just
and
being offline, right? Like going
offline.
outside and playing and And
Yeah,
then also like being strapped to a computer sometimes at the end of the day after school, because I experienced that too, because I'm a millennial.
yeah. So are we understanding the Gen Zs? Are we understanding the boomers? Are we
Yeah,
understanding the millennials? And if we do, can we work better? Can we be more productive? Probably. Um, so
absolutely.
Yeah, for sure. And you didn't mention the forgotten generation. I'm a Gen Xer. Yeah, I don't know what kind of stereotypes we have, except that we're the forgotten generation,
Yeah.
clearly.
It always goes
But
from boomer to millennial. It's just kind of like, hey.
yeah, everybody just goes from boomer to millennial. Don't realize
about Gen X's and my other talk. I just forgot about it today, but
There you go. So, as we slowly wrap up this episode, what's one key takeaway that you'd like to leave our listeners with?
I think people need to recognize that we all age. And whether you're an 83-year-old or a 19-year-old, we all experience ageism. So I think it's important to reflect on how you're being treated because of your age and reflect on how you treat others because of their age. At the end of the day, it's always about empathy, always about thinking about how the other person may perceive what you do or what you say or what you think. And don't forget about age. Remember, you're going to age. We're all aging, if we're lucky, right?
Yes, I'm just going to say that it's
Yeah.
lucky to age.
hmm And we all want to age healthy.
Yes, absolutely. So, taking care of yourself too, right? I guess is maybe a good key takeaway.
Yeah, just one more question to end off with. Even though you're so committed to older adults, you yourself are pretty young. If we were to send you in a time machine and accelerate your life towards its end, and suddenly you're older, wiser, what would you tell your younger self?
I think I would advise me to stop buying expensive skincare because that's not what matters in the end. I actually don't buy a lot of expensive, like anti-aging skincare products, even though it's kind of embedded in my culture.
Yeah,
Um,
Korean culture for sure.
yeah, not because of being an ageist, but really it's just that's how I grew up, is to use, lots of lotion, toner, eye cream, all of that. But all jokes aside, um, I think I would tell myself maybe be around people of all ages all the time, not just in the workplace, and maybe not just older people. I don't know if I really understand the younger generation well either. Perhaps I don't have the same time that I have to understand older people, different generations. I think probably that's something that I would tell me, get to know different generations, how they interact with the world, because the society changes so quickly, and it gets harder and harder to understand each other.
Yeah, that's great advice.
Just one more final question. How can our listeners connect with you?
I don't have social media really, but I told you before, I'm part of the Canadian Coalition Against Ageism. It's a social change movement, and if you join, you can join to volunteer with us. All of us are volunteer, coming out to meetings, attending some of the United Nations and WHO webinars, because we often do work with us to promote healthy aging, but also promote the rights of older people. And that's the best way to reach me because I will be there.
Awesome. Thank you, June.
Thank you.
Thank you so much for joining us, June, and opening our eyes to ageism and how we're all guilty of it, probably, at one time or another.
Thank you so much for inviting me today.
To recap today's episode, we spoke with Ju Eun Lee, a geriatric psychiatrist based in Toronto, Canada. June is a passionate advocate against ageism. She highlighted the World Health Organization's definition of ageism, which refers to stereotypes around how we think, feel, and act towards older adults. Globally, 1 in 2 of us are ageist. Ageism is associated with poor health, social, and economic impacts. The WHO identified 3 types or levels of ageism, that which is self-directed, interpersonal, and institutional. These levels provide key opportunities to leverage when designing ways to combat ageism. June attended the Canadian Ageism Forum in June 2024, which brought together a diverse and inclusive group of older adults and thought leaders to address ageism. June is especially interested in embedding ageism education in healthcare and other workplace settings. June's key takeaways include recognizing that we all age and making intentional efforts to understand different generations. June invites listeners to join her as a volunteer with the Canadian Coalition Against Ageism, a social change movement to end ageism against older people. We hope you enjoyed this episode.
Thank you for joining us on The Edge. If you enjoyed this episode, please share it with others or leave a comment or rating. Stay tuned for more episodes of On the Edge of Health and Design.